The guitar had been an instrument with a long presence in music throughout the history of civilization. Its acoustic design, however, was inadequate for a louder, modern sound, limiting its potential for broader use across a range of musical styles. That is, until the 1940s, when a young guitarist named Les Paul realizes the opportunities of sending sound to the ear in a different fashion and rethinks the guitar. Les Paul invented the solid-body electric guitar, whereby pickups on the guitar take the place of acoustic resonance within the guitar body.
Well, I knew that in order to realize the guitar's full potential in music, that this well-known, loved instrument had to be totally rethought.
Once the solid-body guitar was commercialized, it was quickly adopted by urban blues musicians, who capitalized on its sustaining power to create a style in which the sound of the guitar assumed a quasi-vocal character. This style was adopted in the 1960s by a new type of musician, rock and rollers, who formed bands built around the sound of the electric guitar. These rock guitarists raised amplification to previously undreamed of levels and exploited sophisticated circuitry to achieve extensive manipulation of the guitar sound. Today, the electric guitar is the dominant instrument of popular music, evidence that the rethinking of the guitar led to a revolution in music itself. Now, rethink rheumatoid arthritis for a different kind of revolution. Rethink RA. 30 years ago, B cells were considered a significant contributing factor in the pathophysiology of rheumatoid arthritis. However, evidence pointing to T cells as a pathogenic pathway for RA grew, and the pursuit of B cell-based therapies waned. For much of the time since then, RA has mainly been treated as a T cell-mediated disease. While anti-TNF therapies are effective for many RA patients, 29% to 50% of patients responded inadequately to these therapies in some clinical studies. Recognizing an unmet need for an RA therapy that could reach these inadequate responders to anti-TNF therapy, researchers at Genentech and Biogen IDEC returned to a deeper exploration of the B cell and took a closer look at the mechanism of action of Rituxan, a well-known B cell-based therapy that had been used successfully in the treatment of hundreds of thousands of oncology patients over the past 9 years. This rethinking of the B cell's role in RA led Genentech and Biogen IDEC to the realization of Rituxan for RA, the first and only therapy that selectively targets CD20-positive B cells. Rituxan, rituximab, in combination with methotrexate, is indicated to reduce signs and symptoms in adult patients with moderately to severely active rheumatoid arthritis who have had an inadequate response to one or more TNF antagonist therapies. Rituxan has been associated with fatal infusion reactions, tumor lysis syndrome, and severe mucocutaneous reactions. The hypothesis that selective depletion of B cells would be effective for treating RA is based on emerging knowledge that these cells may play 3 important roles in RA. These roles include antigen presentation that may contribute significantly to T cell responses in RA, the production of autoantibodies that may help drive the disease process in RA, and production of cytokines known to promote inflammation in RA. Selective B-cell depletion with Rituxan in combination with methotrexate has been shown to be an effective therapy in RA, providing powerful and lasting efficacy through 6 months after one course of 2 1,000 milligram infusions in patients who are inadequate responders to anti-TNF therapy. The ACR20 and ACR50 results shown here were demonstrated through 6 months. In some patients who received subsequent courses of treatment in open-label studies, the efficacy was longer. The most common adverse events with greater incidence in the group receiving Rituxan versus the placebo group were hypertension, nausea, upper respiratory tract infection, arthralgia, pyrexia, and pruritus. The most common infections were nasopharyngitis, upper respiratory tract infections, bronchitis, and sinusitis. Of the infusion reactions that occurred with Rituxan, most were associated with the first infusion. Patients on anti-TNF therapy who are experiencing persistent symptoms despite treatment may be inadequately responding. For these patients, Rituxan provides a powerful source of hope. Rethinking RA with Rituxan is helping many patients with inadequate response to anti-TNF therapy realize their potential again. Meet Tim, a Rituxan for RA clinical trial patient from Tacoma, Washington. Tim was a firefighter for 23 years before severe rheumatoid arthritis forced him to leave his job. A family man with a passion for music, Tim missed playing the guitar with his 3 sons in their home recording studio. Tim did have a modest response to one previous anti-TNF therapy, but still suffered from severely affected joints and noticeable joint deformity, in particular in his fingers. Tim's rheumatologist of 16 years, Dr. Philip Meese, knew Tim needed something different and soon began treatment with Rituxan. As of April 2006, Tim has received 4 full courses of Rituxan. He has shown significant improvements in his signs and symptoms of RA. While clinical results may vary from patient to patient, after treatment with Rituxan, Tim enjoys greater overall functioning. As you can see from his chart, Tim has experienced improvement across all clinical measures assessed. He has not experienced any infusion reactions, adverse events, or treatment-related infections with Rituxan.
Tim suffered from severe rheumatoid arthritis, and his previous anti-TNF therapy was providing modest but not optimal response. So I decided to try something new, Rituxan. For me, the appeal of trying Rituxan therapy was that it would provide Tim with a completely different biological approach, with a mode of action entirely new for RA. In my assessment, Tim has had good response to Rituxan. He has experienced improvement in all ACR core parameters as well as in DAS. And Tim's level of response has not diminished with subsequent courses of Rituxan.
Thanks to the powerful and lasting efficacy of Rituxan, Tim can once again spend more quality time with his family. And he has returned to his hobby of playing the guitar. Les Paul's rethink of the guitar provided a new world of music that has immeasurably touched Tim's life. Rethinking RA with Rituxan has allowed Tim to realize his potential once again. Remember, 29% to 50% of patients responded inadequately to anti-TNF therapy in some clinical studies. Are you looking for these signs and symptoms in your own patients? Persistently swollen joints, persistently tender joints, need to increase dose or frequency of administration due to inadequate response? Consider the following: persistent pain, prolonged stiffness, significant fatigue, and tolerability issues. Rethink RA for your patients like Tim. Help them realize their potential once again with Rituxan, the first and only therapy that selectively depletes CD20-positive B cells. Rituxan, rituximab, in combination with methotrexate, is indicated to reduce signs and symptoms in adult patients with moderately to severely active rheumatoid arthritis who have had an inadequate response to one or more TNF antagonist therapies. Rituxan has been associated with fatal infusion reactions, tumor lysis syndrome, and severe mucocutaneous reactions. Additional safety information and full prescribing information are available at this booth.